Tonight, follow one mom's journey from trying to conceive to the expert specialized care she received through the birth of her twins at Penn State Health. Plus, have your questions answered in a live web chat with reproductive endocrinology and infertility specialists from Penn State Health. All on this ABC 27 special presentation, Family Matters, Journey to Motherhood, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. Tonight we're going to take you on a journey to motherhood. Penn State Health specialists will walk us through the process from infertility to conception to delivery. And doctors will answer some important questions like, what are the latest treatment options for women struggling to become pregnant? What role does a midwife play in the delivery process? What happens when an infant goes to the NICU? And if you have questions at home, Denise McCracken is here to tell you how to get them answered. Hi, Denise.
Hi, Deborah. Yes, Katie Watkins, certified nurse midwife at Penn State Health Obstetrics and Gynecology in Camp Hill, is here tonight answering your live questions until 8 o'clock in a web chat. To submit a question, go to abc27.com/motherhood. And I'll be back later in the show to share some of those with you. Deborah.
And thank you, Denise. So what does it take to be a mom? Well, just ask Lancaster County mom Hannah Podelsky. Hannah Podelsky is the proud mom of twins and an 8-year-old daughter. Penn State Health has provided her care every step of the way. Her journey began at Penn State Health Reproductive Endocrinology and Infertility, where she met with specialists who mapped out a strategic plan. A plan that worked. Hannah was pregnant with not one baby, but 2. Doctors held her hand throughout her pregnancy. Because of complications, Hannah was admitted into the hospital at 33 weeks. She was there for nearly a month until the twins were born at 36 weeks. One baby needed to go to Penn State Health's NICU for 36 hours. Then Hannah and her babies, Violet and Ace, went home. Now the twins are nearly 2 years old and they are thriving. And joining me right now is Hannah Podelsky. Thanks for being with us tonight.
Thanks for having me.
You are welcome. Now, you were here earlier on Good Day PA along with your doctor, Samantha Butts, Chief of the Division of Reproductive Endocrinology and Infertility at Penn State Health. Here's a clip from this morning's discussion.
Going into having a second child, my husband and I wanted to wait a while just because, with cost of daycare and just everything in our lives. And around 2020, we decided, all right, we're going to go ahead, we're going to start, we're going to try. Well, 6 months passed, nothing had happened. A year passed, nothing had happened. And we started to get a little bit concerned since we didn't even have to try for our first one, it just happened. So we decided that we were going to seek medical care.
Interesting. And then that's where you come in.
Yes.
So what sort of advice did you give to Hannah as she's going through this attempting to conceive process?
So I told Hannah that it was my responsibility to gather all the facts and present treatment options to her and her husband that we could discuss together. I think it's incredibly important to understand the patient perspective alongside the clinical facts and the science and the evidence in coming up with a treatment plan for an individual patient that's personalized.
Well, that treatment plan, it worked for you. Were you surprised to find out that it was 2 babies?
We were surprised, definitely. My husband was very surprised. But evidently he didn't know that there was a higher chance of that, so that was interesting. But honestly, my daughter prayed for probably a year for a brother and a sister. Every time that we would talk about it, we would say, like, we're only trying to have one more baby, or one more, you'll probably get a brother or a sister. And she'd be like, no, I want a brother and a sister. And every night she would pray for it. So whenever the 2 babies showed up on the ultrasound, I just knew. I just knew that they were a boy and a girl.
Oh my gosh, that's incredible.
Yeah.
That's incredible. I love that story. Many women, they struggle when they're trying to, start the process of motherhood. When is it time that they should consult a professional?
So while on the one hand, this is a very personal decision, there are some important clinical facts that we want to make people aware of in terms of thinking about when to seek a consult. And one of the first things that I tell patients is if you have pre-existing gynecologic conditions that could be a barrier to fertility, it's never too soon to seek consultative care. And those things include conditions like endometriosis, a history of pelvic inflammatory disease, multiple miscarriages in the past. These things are not uncommon. We tell patients when it's a male-female couple who have been trying for a year and they're under 35 years old, that's a signal to seek care. Over 35 years old, trying for 6 months is an indication to seek care. And our current guidelines say for women who are 40 and older, you can start seeking care at the very earliest stages of trying. We see patients who have also a history of serious medical conditions that have required treatment that could compromise their later fertility. Patients who are cancer survivors, patients who have been treated for sickle cell. Anybody who is interested in fertility preservation for their future fertility goals, also important. And we also have patients seek care when there's a need for using treatments like egg donor, sperm donor, gestational carriers for a variety of reasons.
Well, we're so glad you sought care. I'm sure your daughter is so excited too, and you know how much it means to have the right healthcare providers in your corner. So thank you for sharing your story with us. I'm so happy for that happy ending.
And Dr. Butts was so thorough in how she explained things. What was your experience like with her, and why did you say that, hey, Penn State is the right place?
Yeah, Dr. Butts is amazing. I honestly can't praise her enough. We actually went to another practice first, and it just felt like we were a number. We didn't feel like we really, were getting any kind of personalized care. And whenever we met with Dr. Butts, she took the time to really understand us as a couple, like what our beliefs were, what our needs were, who we were as a family. And it made all the difference in the treatment plan that she came up with. We had the advantage of having this expert care, but then also having that personalized team approach with her and the rest of the support staff and nursing team that really made all the difference in our pregnancy journey.
Now, and what advice do you have for someone who is looking to get pregnant and maybe having a difficult time?
I will say that was one of the hardest periods of my life, going through that year of always questioning and always thinking and always having so much anxiety and stress of why isn't this happening? And I think the biggest thing is, one, trust your gut whenever you go and meet with a provider, but take the time to talk to somebody like Dr. Butts, who breaks it down in a way that you can understand, but also takes the time to know who you are as a person. That having that expert level of care really mattered, but having that personalized touch, that's what I really feel like helped contribute. Like, it was a lot of prayers and a little bit of science, and I'm thankful every day.
Yeah, made certainly the difference. Now, we're going to talk more about your journey and also about some of the complications you had. That will be coming up. But in the meantime, if you would like more information, or if you would like to make an appointment with Penn State Health, you can call this number, 717-356-0004, or visit pennstatehealth.org. Now, let's check in with Denise McCracken. What are some of the questions being asked, Denise?
Thanks, Deborah. We have a wide range of questions coming in tonight from our viewers. Katie Watkins, certified nurse midwife at Penn State Health Obstetrics and Gynecology in Camp Hill. You've been very busy tonight. Thank you for joining us.
Sure.
Our first viewer question is, what is a certified midwife, and how do you know if having a midwife is right for you?
So certified nurse midwives all have a nursing background, and then it's advanced education. We have a master's degree. Most people have been labor and delivery nurses in the past when they've decided to go on to become a midwife. In terms of, is a midwife right for you, it varies per person, but there's a lot of ways to have a midwife incorporated into your care, even if you're considered a higher risk type pregnancy.
Our next viewer asks, what kind of services do you offer on the West Shore, and how can someone make an appointment with you?
So the number on the screen, you can call to make an appointment with our office. But in terms of what care we provide, we can help women throughout their lifespan. Anything from just starting their menstrual period to contraception, throughout their pregnancy, postpartum, menopause, so really throughout the whole span of their life.
Very good. And our next question is a frequently asked question. How do you support women after delivery to assist with breastfeeding and postpartum recovery?
Sure. So in the hospital, the midwives can help with some of that. Additionally, we do have lactation consultants that are in the hospital available to see patients. All of the nurses have some education and training in lactation as well. We also support people after they're discharged from the hospital. We have a mother circle that meets once a week that people that either deliver with us or even if they haven't that are having issues can come, and it's a free group for everybody. So that's the biggest way we can support outside.
Great, excellent. A lot of great information, thank you. If you have a question for Katie at home, you can submit that at abc27.com/motherhood. Stay with us, we'll be right back.
The best teams attract the best talent. That's true on the football field and beyond. As Penn State Health opens new locations across Central PA and delivers superior care at its existing hospitals and clinics, it's looking for talented people from all backgrounds to fill positions throughout the organization. Think you got what it takes to join an exceptional healthcare team? Apply today at pennstatehealth.org/careers.
You're watching Family Matters, Journey to Motherhood on ABC 27, sponsored by Penn State Health.
Welcome back. Dr. Jamie Pauli, Chief of the Division of Maternal Fetal Medicine at Penn State Health, is here along with Hannah, her patient. Thanks for being with us.
Thank you for having me.
You are welcome. Dr. Pauli, tell us about your role at Penn State Health and what is maternal fetal medicine?
So maternal fetal medicine is high-risk obstetrics. Our job is to take care of patients who are complicated. They may have medical problems, surgical problems, their babies might have issues, and our job is to kind of get that patient through that high-risk pregnancy safely to delivery.
So when we're talking about risk, we're talking about complications. Hannah, talk to us about some of your complications.
Yeah, so first of all, I will say that one of the great things was that even early on in my pregnancy, Jamie was consulting on my care. She, took the time to look at the ultrasounds. The rest of the MFM team was very much involved. Unfortunately, at 30 weeks, we were getting ready for my daughter's 5th birthday, and I woke up early in the morning and I was excessively bleeding. I was taken to the Children's Hospital via Lifeline ambulance, and I was able to go home briefly, but unfortunately I ended up back in the hospital with heavy bleeding, and I stayed there for the next 3 weeks.
And Dr. Pauli, Hannah mentioned you were right there by her side. How did the team really all work together to provide her with the best care?
So one of the best things about our unit is that we have a labor and delivery and an antepartum unit all centered within the Children's Hospital. So the obstetricians, the nurses, the neonatologists, the pediatricians, the high-risk doctors, we're all there together to make sure that the patient has all the things that they need to make sure that we are ready kind of for whatever happens, and that we're prepared should the babies need to go to the NICU, that there's a team ready and waiting right in the delivery room to take them upstairs and to take care of them.
Now, Hannah, you were there for quite some time, and I understand that the nurses and everyone on the floor actually helped celebrate your birthday. Tell us about the team that was caring for you.
I really can't thank them enough. Like, it was very hard having to be in the hospital and be away from my husband and daughter and dog Nico. But they went above and beyond to try to help not only with my physical health, but my mental health. I did at 35 weeks celebrate turning 35. They made sure I got my cheesecake. They all came and sang to me. Dr. Pauli is a really good singer, so that was great. But yeah, they really helped make it manageable. They made sure like the priest came and checked on me and like brought me like communion, and it really was a wonderful care experience.
Now, Dr. Paula, we're not going to have you sing, but how do you reassure a woman who's going through something like this? I mean, complications must be so scary.
So pregnancy is not for the faint of heart. It can be scary even if you have a completely otherwise normal pregnancy. However, when really scary things happen, like what happened to Hannah and her bleeding, that's really a time when it's important that we are very open and honest with our patients. We tell them exactly what's happening, exactly what we're thinking, what we think the next steps are going to be, and how we're going to take care of both them and their baby or babies. And I think it's also really important to make sure that the patient and their family feels part of the decision making and part of the care team, because this is not my pregnancy, it's not my babies, this is their pregnancy and their babies, and they're just as important as the rest of us.
And Hannah, how did she really help ease your fears?
I think it was really what you were talking about. Everybody would come and they would give me the facts in ways that I could understand. And that was true no matter if we were in fertility, if we were dealing with OB, or we were dealing with MFM or NICU. They really took the time to help us understand and make it not this huge, scary thing. They were honest, but they also were hopeful and empathetic, and that really helped.
Now, Hannah, one of your twins needed to go to the NICU. So, Dr. Paula, how do you work with the team to say, this may actually happen?
So one of the things that we do early when a patient is hospitalized is we make sure that the patient gets to meet our neonatologist if we're anticipating the babies could go to NICU. So they meet them well before the baby is born, sometimes just minutes before the baby is born. We also make sure our groups talk to each other a lot. We have conferences together, we care for patients together, we do consults together, and then we're all in the delivery room together. If we're anticipating an issue or we have a high-risk pregnancy, we make sure that everyone is there, including the NICU.
Yeah, and that's when we were talking earlier, Hannah, you mentioned, the NICU nurses, they were there and they were just waiting for the twins to be born.
Yeah, and it gave us this sense of security. We knew that there was a team there for us, but there was a team for each of them as individuals, and it gave us a lot of peace knowing that we were in the right hands.
Yeah, I am sure. Now, Dr. Paula, we have to talk about the expansion. Your team has certainly expanded to Lancaster County, to Cumberland County. How do you all work together to make sure everyone is taken care of and feels at ease?
So yes, our expansion has actually been really great. We have patients now that are getting an opportunity to be cared for in their communities, to have their own doctors caring for their babies. However, from the MFM side, we're there if there's a complication or a question or advice that needs to be given to help take care of a pregnant person. We're there to help, and then also our patients and also the referring doctors know that should something arise, we're right there. They can transfer the patient, they can call us. We're available at the drop of a hat to give advice or to say, yep, send that patient here and we'll take good care of them until we can send them back.
Okay, thank you so much. Always good seeing you, Dr. Paula. Hannah, we're going to have you stay with us because we have more coming up talking about your journey. And if you would like more information, or if you would like to make an appointment with Penn State Health Maternal Fetal Health, you can call 717-956-1584 or visit pennstatehealth.org. Let's check back in with Denise to get answers to more of our web chat questions.
Thanks, Deborah. Here with us again is Katie Watkins, certified nurse midwife at Penn State Health Obstetrics and Gynecology in Camp Hill. Our next viewer question is, if I am trying to get pregnant, when should I start taking prenatal vitamins?
So we recommend that anybody of childbearing age should be taking a prenatal vitamin just to help your body get ready, and also you just never know when something could happen.
And our next viewer asks, if I take a pregnancy test and it is positive, when should I go to the doctor for confirmation?
So every practice does things a little bit differently. For our practice, we would typically have you do blood work at a time that we determined was appropriate for when your last menstrual cycle was. And once that gets to a certain level, that's when we would send you for your first ultrasound. And once we know that you have a viable pregnancy, that is when we would have you come in and do your first nurse visit and prenatal visit with one of the providers.
Our next viewer asks, are there any lifestyle changes like diet and exercise that help women to conceive?
So being as healthy as you can going into pregnancy is very important. So, typically we say like healthy diet, trying to make sure you're getting exercise in, just really taking care of yourself kind of in all aspects, mental health, physical health, that type of thing when you're kind of thinking about and working towards pregnancy.
Katie, thank you so much for all of your information. Sure. You'll be here until 8 o'clock. So if viewers at home have a question, they can still go to abc27.com/motherhood. Back to you, Deborah.
And thank you, Denise. And I did want to mention that tonight is your last show, and I wanted to thank you very much for all the time you have put in working here at ABC 27 and during these Penn State Health shows. You will be missed, but I know you want to spend more time with your family.
Thank you. It's been an absolute pleasure.
You are welcome. Hannah is back with us now to share more about her journey, along with Dr. Dennis Muse, Medical Director of the Neonatal Intensive Care Unit at Penn State Health Children's Hospital. Thanks for being with us.
Thanks for having me.
Hannah, why don't you tell us, we had mentioned that one of the twins had to go to the NICU, Ace. Tell us about that.
So whenever we went in for our C-section, like I said, we had both the teams of nurses there from the NICU for each of them. One of the things that we quickly realized was that most of the nurses were starting to gravitate towards Ace. He was having a little bit of difficulty breathing, so they quickly stepped in, assessed him. We were able, obviously, to get a picture together as a family, as you saw at the beginning, but he then went to the NICU.
And Dr. Muse, how do you really help moms like Hannah understand why their babies need to go to the NICU? I'm sure they're shocked by that fact, like, oh my goodness, what's happening?
Right. Well, this is always a difficult time when a baby needs to go to the NICU. There's a separation from mom and the baby. It's a period of uncertainty, a period of being afraid, and a feeling of loss of control. So we like to inform the family as best we can about what's likely to happen, how we're going to manage it. We don't always know what precisely is going to happen. We try to begin a process before the baby's born, and I met Hannah and her husband prenatally, and we went over some of the possibilities, but sometimes we don't really know until the babies actually arrive. And as you heard, Ace required some help and his sister didn't. So we started the process of informing there in the delivery room and tried to give a brief synopsis of what we're expecting upstairs. It's difficult for dads also, and Ace's dad did accompany us up to the NICU so he could see where his son would be and report back to Hannah.
And I'm sure it does give parents some comfort knowing that Penn State Health has the only level 4 NICU in our community.
Right, and it's an honor to work in a level 4 NICU and a NICU like ours. I think it offers a large dose of reassurance to families and to parents that our service will follow up on the high-risk maternal fetal medicine service. So we have the ability to care for the tiniest, sickest babies. We have all of the specialists needed under one roof to provide whatever services are necessary. So I think it's reassuring to families to know that their baby can receive all of the necessary care here in central Pennsylvania at Hershey without having to leave the region.
And Hannah, I'm sure that certainly gave you reassurance knowing when Ace had to go there. What was your experience like?
Honestly, whenever we were thinking about OB care, one of the things that really sold us on Penn State Health was the fact that there was the level 4 NICU. I knew that no matter what, no matter how complicated or how hard, that we would have everything that we needed right a floor above. We knew that they had specialized rooms for twins. We had all of that. And honestly, even in our case, whenever I went in at 30 weeks, Dr. Muse was the doctor who came down to talk to us. And I can remember for the next few weeks that my husband would just recite back what he said. And that it gave him a sense of comfort because he came in with facts and he put it in a way that he could then understand, we need to get to this point. If we get to this point, this is what will happen. And it just made it a lot more manageable and a lot more secure for us.
Sure, and made you feel much more comfortable.
Oh, absolutely.
We see miracles. I'm sure you see miracles all the time there in the NICU. What makes your job so rewarding?
Well, we do see miracles all the time. Most of our outcomes are good. A NICU has to function as a team, and I'm really honored to work with a first-class team at Hershey The nurses, the advanced practice clinicians, they're really superbly trained, special people to help deal with families like Hannah's. As a physician in a NICU, it makes sense that I take care of babies, but over the years, one of the things that I've come to really appreciate in my job is caring for the parents and the families, because it's a very difficult situation for them to be in. I like to advocate for them, inform them, educate them, and remind them that they're the most important part of the team caring for their baby. We like to help them feel like they're their parents, prepare them for discharge, and that's a big rewarding part of my job. And it goes without saying, to reconnect with someone like Hannah is special beyond words.
Sure, definitely. And Hannah, so we've heard a lot of great information tonight. You know, why would you encourage women to choose Penn State Health?
I think there's the perfect combination of, you know, expert, advanced technology at Penn State Health, but it's married with this personalized care that you aren't going to get anywhere else. There's, you know, just that continuation from, you know, going for fertility treatments to having our obstetrics care to being with MFM and then ultimately NICU. It was all just seamless and worked like fluidly. Our first experience with our older daughter, it wasn't great. Like, we were going in with a lot of apprehension, and Penn State Health just gave us such a great peace of mind, and I would highly recommend them to anybody.
Great. Thank you so much for sharing your journey with us. So much encouragement from you, and Doctor, thank you for being with us too. And we send a special thanks to Hannah for sharing her journey, and you, our viewers, for sending in your questions. If you would like more information, or if you would like to make an appointment with Penn State Health, call this number 717-956-1584 or visit pennstatehealth.org. Next Thursday, May 2nd on Good Day PA, Penn State Health will host a special program about cancer survivorship. Meet two women who overcame a cancer diagnosis and are spreading the word that there is life after cancer. Also learn how the Penn State Cancer Institute Care Center provides support to patients and their families during their cancer journey. Once again, that's next Thursday at 10 a.m. on Good Day PA. We want to thank you for watching tonight, and we wish you good health.